Namaste and welcome to Dr. Shah's clinic. In this video, we are going to answer a very simple question, that some of my YouTube subscribers have asked me. And the question is, what's the difference between semen and sperm? Now, a lot of patients, when they come to the clinic, they worry, they think that maybe their sperm counts have become low, or their fertility, they've lost their fertility because they notice some color changes in the semen, or they notice that the seminal volume has become very less, or the semen has become very watery. So they come with numerous, kind of concerns. But I think the fundamental problem here is there's a clear distinction between the semen as well as the sperm. Now, if you look at the image on the right, I've shown you the anatomy of the male reproductive system. Now, it's important to understand that, the sperm is actually present in the semen. So the sperm actually occupies only about 1% of the semen. And the semen is basically made out of fluid contributions that, originate from, the three organs that have been highlighted on the image on the right. So the semen is basically made out of fluid contributions from the prostate, number one. Number two, the seminal vesicles. Number three, the bulbourethral glands, also called as the cowpers gland. And number four, the last component of semen is usually the spermatozoa. What's very important to understand here is that the seminal vesicles, are two organs which contribute the largest proportion of the semen, almost 60%. And second, the prostate, contributes about 30% of the overall semen volume. So say an individual, makes about 2 ml of semen or 3 ml of semen. Say 3 ml of semen. About 1.5 to 2 ml will come exclusively from the seminal vesicle itself. About 0.5 to 0.7 ml will be specifically from the prostate. The remaining 0.1 to 0.2 ml will be from the cowpers or the bulbourethral glands, and only about less than 1% will actually be the spermatozoa or the sperm cells. So in general, there's a clear distinction between semen as well as the sperm. The sperms are present in the semen, but they occupy just 1% of the semen. So technically, you cannot actually look at the semen at the time of ejaculation and try to make comments or form assumptions about a man's overall fertility. However, there is a condition called retrograde ejaculation or partial retrograde ejaculation or anejaculation. What happens in these specific scenarios is the semen volume will be very, very low. So in the place of actually 1 ml or 2 ml or 2.5 ml, only 1 or 2 drops, the individual note only 1 or 2 drops on the ejaculate. In these instances, you can definitely suspect severe male factor infertility. But apart from this particular clinical scenario of retrograde ejaculation, anejaculation, or congenital bilateral absence of vas, or ejaculatory duct obstruction where the seminal volume is going to be very low, and there by de facto or by default you expect the sperm numbers also to be low. Apart from these conditions, in general, for most men, even men who are azoospermic, the semen volume will be normal unless or until it's not obstructive azoospermia. You can't really come to a conclusion unless you do a microscopic examination of the semen, or you do a semen analysis. You cannot make comments about the sperm cell. So please try to enlighten yourself, and there's a clear distinction between semen and sperm. Remember, the sperm occupies only 1% of the semen, and you have to put your semen under the microscope. You have to do a semen analysis or a sperm test to actually find out and know more about your sperm motility, concentration, morphology, etc. I hope you found this video informative. Please like, comment and subscribe. Click on the bell notification icon. This is Dr. Shah. Vanakkam. Namaste. I'll see you soon with another video. See you soon.